We know that during an ischemic cardiac event, we can have ST segment elevation or depression on our EKG. But have you ever thought about what actually causes these changes? For cardiac cell depolarization to occur, we're going to need the inside of the cell to reach negative 90 millivolts, meaning the inside of the cell needs to become more negative. For that to happen, potassium channels open up and potassium pours out of the cell. Now, it's extremely important for us to understand that cardiac cells use ATP or adenosine triphosphate to control their channels. Now, once potassium pours out, sodium channels open up and sodium pours inside of the cell, which pushes us above our threshold. Once that happens, sodium channels close and calcium, which is responsible for cardiac cell contraction, pours into the cell. That will give us our plateau and cell depolarization. Once that happens, sodium channels as well as calcium channels close. But because potassium is still pouring out of the cell, we will come back to our baseline. Now, what happens during a subendocardial ischemic event is that the ischemic cells lack the ATP they need to keep the potassium channels shut. So the potassium channels open up, potassium pours out of the cell, and actually what this does is causes a premature depolarization of the healthy tissue around the ischemic area. And because this depolarization is happening towards a positive lead, what this will do is that it will actually raise your isoelectric line. And then what happens is that the rest of the ventricle depolarizes like it normally would, doesn't really care about the events prior. So what happens is that your isoelectric line goes back to where it should have been originally. So then it will give you the appearance of a ST segment depression, where in reality you have a raised isoelectric line at the very beginning of your cell action potential event. Now, during a transmural ischemic event, meaning when the entire full thickness of the cardiac muscle is involved, the same early depolarization occurs. However, it can only happen away to the surrounding healthy tissue, meaning away from your positive lead. And you guessed it, guess what that does? What it does is that it actually depresses your isoelectric line at the very beginning of your cardiac cell cycle. And then you have your QRS complex, and guess what happens to your ST segment? Yes, it goes back to where the isoelectric line should have been, and it will give you the appearance of ST segment elevation. When in reality, it is not your ST segment that's been elevated, but your isoelectric line at the very beginning that's been depressed.